Good morning, everyone. My name is Debes from the University of Minnesota, and I will be talking to you today about hepatitis B awareness and perceptions among healthcare workers across Africa. And this is a report from the African Hep B Network. These are some of the authors in our paper, and I have nothing to report in terms of conflict. I don't have to tell this audience the problem that hepatitis B is in Africa. It affects quite a large number of people and causes quite a large number of deaths. This is a study that we did a few years ago showing that about 40% of patients with hepatitis B and liver cancer get diagnosed before age 40. So we can see that hepatitis B can affect people very early in their lives. Now, one of the big problems here are the chronic manifestations of hepatitis B. And reality is that in the great majority of patients, they have no chronic symptoms. So unless the individuals know that they have hepatitis B, there's no other way for them to be screened or be assessed in the clinic. One could then postulate that there is a problem of lack of awareness of hepatitis B across the African continent. With this in mind, we created the Pan-African Survey on Hepatitis B Knowledge and Awareness among healthcare workers. In order to do this, we first created the African Hepatitis B Network, which is still active. We created a survey that inquired about different aspects of hepatitis B, and we distributed it hard copy in different languages. We requested a minimum of 15 surveys per center and a minimum of 3 professions per center. We obtained 1,044 responses, which is quite a bit, from 12 different African countries. And you can see in this map some of the African countries that were providing the answers. Now, if I look at the main demographics here, we can see that 92% of these responses were in English, which already could talk a bit about a bias. And 54% of them were females, with 46% being male respondents. The demographics in terms of profession was quite good. We can see that 25% of the respondents were nurses, 20% residents or interns, 5% consultants, and 10% lab technicians. So we had a nice mix of professions across the healthcare sector. Some of the basic answers that we received, about 65% of respondents indicated that they were aware of the hepatitis B status, and 61% said that they have received the hepatitis B vaccine. Depending how you look at this, you could say this is good or this is not that great. We believe it's not that great as we're talking about healthcare workers, so we think this is quite a large gap in here. Some of the other concerning findings include the fact that 4% of respondents indicated to know a family member with hepatitis B. Considering the epidemiology of Hep B in Africa, this is quite low, and we believe there could be a representation of social stigma and lack of disclosure of the disease. Finally, we also found that in those that responded this, less than 50% mentioned that their children were vaccinated against hepatitis B. That is very, very low. One could argue, though, that maybe the provider doesn't know the exact vaccines that their children received, but still these are healthcare workers, and this number, we believe, is quite low. When we look at awareness across occupations, we didn't find major differences. Only medical trainees, which is the first bar here on the left in each variable, were more aware of their hepatitis B, their vaccination status, and the vaccination of the children, but the other professions were pretty similar. Moreover, when we asked the surveyors, like whether they knew the transmission routes or whether they knew that working in a hospital increased the risk of obtaining or acquiring hepatitis B, the great majority responded positively. If we look at this graph on the right, over 90% of them knew that by working in the hospital, they were at high risk of acquiring hepatitis B. These are some of the responses by country. There's a lot to see here, so I won't go through it. Just for you to know that Cameroon had the highest rate of awareness of hepatitis B, Kenya, the highest rate of vaccination, and Egypt the highest rate of vaccination of children. But keep in mind that in several of these countries, we just got responses from one center only. So this answer should be taken very cautiously. We finally decided to divide the answers between East and West Africa. There are many ways to divide East and West Africa. We did it, as you can see in this slide, and we removed North Africa. We did not find major differences, but some of the things that we found was that West Africans were more aware of their hepatitis B status than East Africans, 80% against 60%. We also found that the reasons for non-vaccination were different actually in each part, with 60% of West Africans citing cost as a reason for non-vaccination, and 40% of East African citing other causes as reasons, and this included not knowing where to get the vaccine. So as a summary, we found large gaps in hepatitis B serostatus awareness and vaccination across Africa in healthcare workers. We did find that healthcare workers clearly understood that working in a hospital increased the risk of hepatitis B. Nonetheless, 60% of them only were vaccinated. We found a very low hepatitis B vaccine uptake among children of healthcare workers, but this could be biased due to the fact that they didn't know the vaccines they were receiving. And finally, we found evidence that we think that hepatitis B still represents a source of social stigma in the continent. These are some of the acknowledgements. The African Hep B Network members are all here, many countries, as you can see. And here are our funding sponsors that we'd like to thank. And finally, I can take questions if they're available online. Otherwise, please visit our African Hep B Network to find out more. Thank you very much.